Hi, everyone. Today we are going to be learning about shared mental models. Shared mental models are mental representations that team members hold about themselves and the task, and how the team works toward the task in their environment. The literature commonly divides shared mental models into two categories, task and team. Task shared mental models represent the shared understanding of the task, the potential challenges that exist within the environment, and their solutions. Team shared mental models represent the shared perceptions of team members' individual characteristics and interactions related to the task. Shared mental models allow us to predict what individual team members are going to do in order to successfully complete the team's goal. Further, shared mental models have been tied to multiple important team outcomes. Research done by Johnson and Lee, as well as Espevic and colleagues, has illustrated that targeting the development of shared mental models and their similarity positively impacts team and individual level performance. In addition, high team member reports of shared mental models are related to enhanced team coordination in virtual and in-person teams. The literature has also connected shared mental models to strengthen team adaptability based on the degree of consistency in the shared mental model. Shifting to team outcomes specifically in healthcare settings, research has illustrated the importance of shared mental models in multiple healthcare contexts, including patient care, handovers, and multidisciplinary teams. In patient care contexts, research has shown that an inconsistent shared mental model can result in decreased patient care quality through increased employee frustration and miscommunication. But strengthening the shared mental model can improve a team's ability to implement goal-oriented care strategies. In patient handover contexts, a mismatch in communication between shifts is indicative of a weak shared mental model. However, Sochette and colleagues found that targeting the shared mental model by standardizing the patient handover process had extensive team benefits, including improved punctuality and attention in physicians, nurses, and transport staff. Lastly, strong shared mental models are important for team success in multidisciplinary team settings that include members from various healthcare fields and job levels. Two major ways that the quality of the shared mental model is diagnosed are calculating the accuracy and the similarity. The accuracy means the extent to which the team is correctly understanding the task. This is usually computed by comparing the team's understanding of the task to a subject matter expert's understanding in conjunction with a task analysis. Similarity represents the consistency in responses between all members of the team, which is usually calculated through a specific software like UCINet. Three common research-backed methods of supporting shared mental model development include formulating a team charter, promoting communication between team members, and implementing empowering leadership practices. A team charter is a formalized document developed by team members outlining the team's goals and purpose, specifics on task strategy and role distribution, and guidelines for team member interaction and performance and conflict management. The team charter is a tangible representation of the shared mental model. Liu and colleagues suggested that creating a team charter would be useful in unifying the team's perspective. Communication is a significant positive antecedent of shared mental model formation due to increased knowledge sharing behaviors. Lastly, leadership plays a major role in the development of the shared mental model. Studies have shown that teams with an empowering leader had a greater rate of improvement in performance over time, which was partially statistically accounted for by shared mental model development. Recent literature has extended shared mental model significance to new areas. First, human agent teams are made up of both human and AI agents. In this study, researchers compared shared mental model similarity between teams based on the ratio of human to agent members and found no significant difference in ratings between groups. Secondly, recent research has explored teams outside of traditional office contexts. For example, Price and Collins implemented an intervention to formulate and evaluate shared mental models between soccer coaches and players. Lastly, multi-team systems occur when multiple teams interact together to serve a larger shared goal. But dissimilarity of the shared mental model between subteams has been linked to enhanced team conflict and decreased implementation of system knowledge. That is all for this presentation. If you have any questions about this content, please reach out to the center at instep@health.ucsd.edu. If you would like to learn more about shared mental models or explore any of the articles discussed in this presentation, scan the QR code and you will be directed to a Google document with a full reference list. Thank you.